In a shocking turn of events that has rocked the healthcare community, UnitedHealthcare CEO Brian Thompson was tragically shot to death in New York City on December 6th. In this episode, we talk about the tragic event, the public's response, and what this really means for the healthcare in the United States. Let's get started. Welcome back, everybody, to the Building a Lifelong Athletes podcast. Thanks so much for stopping by. I really appreciate it. For those of you who don't know me yet, my name is Jordan Rennicke, and I'm a dual board certified physician in family and sports medicine. And the goal of this podcast is to keep you active and healthy for life through actionable, evidence-informed education. And today we're taking a little bit of a detour. You might be thinking, building lifelong athletes, what does this have to do with anything? Well, this is something that's just been a huge news event in the community. It's been everywhere in the news. And it's a really big thing in terms of the healthcare community. Obviously, I work in healthcare, and so for me, this is a big thing. And I just wanted to talk about it, kind of take my a couple minutes here to share my thoughts on this and my perspective on it. And overall, if you haven't heard about this, what happened? Well, first of all, Brian Thompson, he was the CEO of UnitedHealthcare, and he was shot to death on December 6th. And the gunman, who's actually still at large at the time this podcast was recorded, waited for him for several minutes, it sounds like, then shot him several times in New York City, where he was for his company's investor meeting. And it appears that he was specifically targeted by this person because on the bullets, they were etched the words deny, defend, and depose. And it's up for interpretation what those mean. But ultimately, that kind of indicates it's pretty premeditated. And I just want to talk about what this was. This really kind of struck a chord with me. And, if this isn't your cup of tea in the podcast, that's okay. I understand that. But for me, this is just kind of put on my heart to do. And overall, it was really tragic. The reaction, there's kind of been two really vastly different opinions that I've seen online. And this is one of those moments where like social media sometimes just, it's not the best thing in the world. I've kind of seen on the LinkedIn community where I'm more connected in with like the healthcare community. It's very somber, People are just very sad about this. Whereas if I kind of go in the internet at large or social communities at large, things like Reddit and X, not so much the vibe there. That's for sure. It's a little bit different. What's been really unfortunate is I see posts about people pretty much saying how they're glad this happened and that he deserved this and that his corporation did this to millions of people as well. And I think it's a whole different thing. I think it's a lot more challenging than that. But overall, it's been a challenge and it's been a struggle to see that there's so many people in this country, that are struggling and are hurt so bad to the point where they think this is a good thing. I think if we step back and think about, this guy was a husband, he was a father, and he was killed in cold blood in the middle of the street. I mean, that's if you stop and like break it down to the components of what actually happened, I think pretty much no one's going to say this is a good thing. But I understand where those sentiments are coming from. Obviously he's a big public figure and a big public company that's made a lot of money. And, there's numbers around how much money he's made, what he's done before, what he's done. I mean, one of those things, like, I just want to step back and just be like, this is a human being, right? Like, this is a human being, and we should not be celebrating the death of a human being, in my personal opinion. And getting politics aside and corporate, whereabouts and what they've done aside, I think ultimately that's the thing that hit me the hardest was like this, this could be someone I know. This could be someone who runs my hospital. This could be anything like that. And it's a sad thing to do that. And yeah, it's been challenging. And as a healthcare worker, I think maybe I'm hit by this so much is because our job is to take care of people, right? This is what we do day in and day out. We take care of people. And I think the reason it hits us so deep in healthcare is because we quite honestly could see ourselves in that position. And I'm not saying, I'm a CEO of a multi-billion-dollar company that does ethically questionable things on the regular. I'm not saying that, but I'm just saying we've all been there in healthcare. We've pretty much, if you've worked in healthcare in the inpatient setting or outpatient setting, you've been in these situations where you sometimes wonder, like, my gosh, like what's going to happen? I mean, I have seen countless irate patients in the hospital, right? If you're taking care of someone in the hospital, it's their worst day. They're feeling down. They're sick. Maybe they're scared. Maybe they're on, knocking on death's door. There's lots of things that are going on, lots of emotions. It's a very scary place to be. And I've seen lots of angry patients at the time in terms of treatment plans and all that stuff. And it's really challenging. And you're trying to do your best, right? You're trying to do what's best for them, but how that's interpreted by people can be different. And so, it's really challenging. I mean, when I'm working inpatient, I've had, patients leave AMA, which is against medical advice. We're saying, hey, like, I'm so worried like about you. If you leave, like, I'm worried you're going to die. I've had patients say, it doesn't matter. They're screaming, in the middle of the night, they're screaming at me, at the nursing staff, swinging, throwing punches at nursing staff. I mean, just seeing a lot of stuff. And the sad thing is if you work in healthcare, like everyone has a story like that. It's not just like, it's a one-off too. Like, no, everyone has a story about that. And once again, I'm not saying like, oh, we're all high and mighty. Look at me working in healthcare. We're not guilty. We're not innocent in this necessarily. I'm not saying we're guilty or complicit in things, but we've all been exposed to that. And that's the thing I'm trying to say is like, this is something we've all seen. During residency, we had a lockdown one time because someone was coming to the emergency department with a loaded gun. And so we had to lock down the whole hospital. So like we've been there, you're there, it can be scary. And it's really, yeah, we've all been there. And that's like the biggest thing when I heard this news for me, like this is just my perspective, right? And I'm not saying anyone's opinion, this is America. You can have your opinion, you can do whatever you want. And I'm not here to change your opinion on anything, but I'm just kind of sharing my side of things from a healthcare perspective is like, we all could see ourselves in that situation. Because all it takes is just one person who felt like they were slighted or mistreated or misdiagnosed or something to come back and find you and to shoot you. And that's unfortunately like something pretty much everyone in healthcare has thought about it sometime is like, oh my gosh, I hope this is okay. And, we have some security, but like ultimately if someone wants it to happen, it's going to happen. And for me, like ultimately this is just like not a place to celebrate. A man lost his life, like I mentioned before, father and husband. And no matter what someone has done in America, I just don't think we stand for vigilante justice, right? We use our justice system, and I get that when people say it's corrupt, so we got to take things in our own hand. Like I don't know. I just got to ask, like, well, if that's your opinion, then what's stopping someone from doing that to you? If you have a different opinion, that's the biggest thing for me, right? The logic follows that, like, okay, I don't like what they do, so I'll do this. Well, it's like, well, if someone doesn't like what you do, then they're allowed to do that. And because if it's a subjective thing of what's right and wrong, and so it's just a hard thing. And why did this happen? Ultimately, why was he murdered? Nobody knows for sure yet, right? They haven't found the person. But I think overall, the real reason I want to talk about this is clearly this is stemming from somewhere in the community at large, in the population at large, is, based on the reactions that I'm seeing, people are fed up with our insurance system. And I think that is so valid. That's the one thing I do want to validate is I understand being fed up with the insurance system because it is awful. It is so broken. Our entire healthcare system is just so broken. In America here, we love having choice, right? We like the newest things. We want care. We want the newest care. We want the best care. We want the fastest care. And we want the choice to choose what we want. And so by doing those things, we've kind of created this insurance system where people, how do we get everything we want? Well, you commoditize it and you turn it into a business. And that's ultimately what we've done. But it's very broken, right? Patients hate this. Physicians hate it too. And that's the big thing. Patients are like, oh, I wonder how much it's going to be. Physicians are also will do something and we have no idea in terms of how much it's going to cost a patient. Like that's the hardest part about this, current system is like, you want to do right by the patient and you don't want to bankrupt them. That's like the number one goal. But like, it's such a hard game with insurance and the middlemen to figure out like how much money does it actually cost to perform this healthcare? We don't know. And so I also want to say, like, doctors aren't just like, yeah, we love it too. Like, no, we don't like it as well. And I know patients hate it too. And ultimately, I think it's time to make a change. We're kind of coming to it seems like a boiling point, like a big change is going to happen here, I think, in the near future. And hopefully that's me being optimistic, but I think it's kind of time for a change. It's been very clearly identified that what we're doing is not working, right? That, insurance has become this thing that it ties you to your job. It determines, it's the number one cause, medical debt's the number one cause of bankruptcy in America. And it's just, there's a lot going on. It's really there, but we need to figure out a way, like, how can we make this change? What can we do? Well, I think like removing a lot of the middlemen might be helpful in terms of, so we can understand how much the healthcare we're receiving is going to cost. And essentially this is going to have to happen through like sweeping healthcare reforms. I don't know what that entails. I'm not someone who's studied this in depth. Obviously I'm just a doctor. I'm just doing stuff and trying to help patients. And so I don't have the big brain to figure out what we're doing, but clearly what we're doing is not working. There's been some cool alternative options, some innovative things like direct primary care. I don't know if you've ever heard about that, but essentially what that is you work directly with a doctor. They don't have insurance. So obviously that can be challenging for some people, but you pay a pretty nominal fee. I've seen anywhere from like $50 to like $150 a month to essentially have access to your primary care doctor with no insurance. And they can go straight to them. You can talk with them. You can get care. You don't have to worry about insurance at all. Medications can be greatly reduced in terms of like a couple dollars a month for your monthly medications, potentially. Labs can be cheap as well. So the cost of healthcare is arbitrarily high because of the system we have necessarily. And when you remove that system, you might be able to deliver it in a totally different way. But that's I don't know if that's the option for everything, but it's just got me thinking of like, hey, what can we do, right? What can I do? What can I do as a physician, help change the system? And maybe the answer is to get out of the system and to start creating it in the way we want to do it and do our own thing. And this is ultimately what I want to do. Like I just want to give you options and empower you. And like, for the reason I do this podcast, and this is why ultimately this triggered my mind, is that, this happened and this is scary, and the insurance world is scary and medicine is scary because it's just a lot going on in America. But like, my goal for you in this podcast is to have you use insurance as little as possible. I want you to take your own health into your own hands, and I want you to bet on yourself. I think that's the best play for health. Can bad things happen that are out of control? Absolutely. You can get in a car accident. You can get cancer. You can get an autoimmune condition. Like, things that are out of control can happen. And I get that. I totally get that. But the least amount of time we have to interact with the medical system is probably going to be better for you. Now, I'm not saying put your head in the sand and be like, I have no worries. Like my cholesterol's out of control. I have diabetes. My blood pressure's bad. Like I'll just forget about it. Don't go to the doctor. No, I'm not. That's not what I'm saying. But I'm saying, hey, if you lock in those things I talk about all the time, right? The necessary 9, if we lock those things in, then the amount of healthcare you will need will probably be significantly less than most people. And we have to interact less with things. And that's ultimately the goal, right? That's why I do this podcast, is to help you stay healthy and active for life. And, the healthcare system is part of how we get healthcare, right? It's how we deliver care to you. So if we can bypass that as much as possible by just taking your own hands, that's ultimately what I want. But I know this is not a normal one for me, but this is timely, and yeah, just really hit on my heart. And I've been praying for the people involved in this, and it's just been a tough situation. And for me, yeah, it just hit me personally, knowing that I've had times like this where I've worried like, hey, will someone come in and do something, even or you're as a bystander. You've heard stories of that, right? People going to outpatient clinics and coming back and shooting a doctor. And so this is a CEO. But it could easily been insert anybody in healthcare because it could happen to any of us, and which is the kind of sombering thing. So, but if you did listen to this, though, I appreciate you. Life is still good. I'm not trying to bring you down by any means. I'm doing all right, so don't worry about that. But I just wanted to talk about it because I think every once in a while you deserve to talk about some hard things. And so, but if you did listen all the way through, I appreciate you. Thanks so much. And if you found this helpful, if you could leave a review or share with a friend who you may think may enjoy the well, that would mean a lot to me. But if you want to stay up to date with the latest news as well, you can sign up for a newsletter. But overall, this is it. So get off your phone, get outside, and we'll see you next time. Thanks for tuning in.